Cahirley, thank you, and thank you for facilitating me. First of all, can I thank my colleagues in the regional group for tabling this motion, and my newest member, independent member of the regional group, Deputy McHugh, you're very welcome on board. I also want to thank Catherine Gowlev for her assistance in relation to this. And can I, at the outset, thank every member in the House who spoke, both government and opposition, in support of this motion, and the fact that this is being unanimously adopted by the House, I think, is a clear message, and will hopefully see the proposals in this motion adopted. Minister, I was contacted during the week from Mary. She's been trying to get an appointment with a dentist. She rang every dentist in County Roscommon, every dentist in County Mayo, every dentist in County Leitrim, and not one of them were taking medical card patients. Now, this is a single parent with 2 adult children who she is their primary carer. And she's put it to me, it's not easy to survive on her welfare payments. And, you know, she is someone who worked all her life. She was forced out of employment back in 2015. She paid all of her taxes like everyone else. And to be honest, I feel like I'm begging to get the help that I need today. And you know what, Minister? For people like Mary, it's just not good enough. Now, under Section 67 of the Health Act of 1970, the HSE is obliged to provide dental treatment and dental appliances to persons under the medical card scheme. They are obliged to provide it. Instead of that, they have turned their back on those people who are struggling to cope. Now, the Minister here earlier on this evening spoke about engagement with the Irish Dental Association. It is my understanding that the last engagement that took place with the Irish Dental Association was last March. That's the engagement that's taking place. And surely, for the sake of Mary and every other Mary around this country, get around the table, resolve this issue, and ensure that people can get access to treatment. Minister, in my own area, in Galway, Mayo and Roscommon, 36% of the dentists that were in the dental services scheme have left in the last 2 years. We're now down to just 36 dentists across our region, none of whom, not one of whom, are taking on additional patients. Now, prevention in relation to our dental services is far better than cure. And if we look at the oral health checks that have taken place over the last few years for children in 1st and 2nd class, 4th class and 6th class. And if we compare the figures for 2019 to the figures for the middle of this year, across Galway, Mayo and Roscommon in 2019, 11,632 children got access to that dental assessment. Up to the middle of this year, that was just 3,429. And the bulk of those, 53% of those, were in County Roscommon, 29% in County Mayo, and 11% in County Galway. There has been an appalling fall off in the number of dental assessments that are taking place of children within our primary school system, and this is only storing up trouble for the future. In relation to our orthodontic services, again in Galway, Mayo and Roscommon, we have 1,343 children waiting on orthodontic services in our region. And Minister, the final issue that I want to bring up with you is in relation to people with a disability. And as you know, Minister, people with a disability, they haven't the same ability to communicate. They haven't the same ability to express, where the pain is exactly in their mouths, what is causing the pain and discomfort. And those people, their backs have been turned on those people in terms of the provision of dental services. I've one constituent, Francis. He was added, an adult individual with an intellectual disability. He was added to the urgent inpatient waiting list on the 11th of November of last year. Now, Francis ended up on the 28th of November of last year with swelling to his face, hallucinations and confusion in Galway University Hospital Accident Emergency Department. Now, no one wants to be going into that Accident Emergency Department any day of the year, not someone with an intellectual disability, with swelling of his face, hallucinations and confusion. He spent 7 hours, along with 151 other people in that emergency department on that particular day. He is still waiting today for his emergency treatment. And it's not just in relation to adults. In relation to children with a disability that require to go under an anaesthetic, it's the same situation. Children on the autistic spectrum who need to go under an anaesthetic, they are being excluded from provision of dental care today because of that. And the children that are in mainstream, we've encouraged children with a disability and children on the autistic spectrum with a disability to be in the mainstream education system, but they are being shut out of access to these services today. And it's not good enough that this is happening. Now, in fairness, Minister Rabbitte contacted me before the debate today, and Minister Rabbitte has committed to working with the regional group of TDs to try and address the disability issues in relation to it. But we all know that if we actually neglect oral hygiene, it leads to emergency dental issues, advanced oral lesions, chronic ill health and sepsis, all adding, like the case of Francis, to pressure on our emergency departments that just cannot cope. So I'd ask you, Minister, the one final ask I have is sit down with the Dental Association, resolve these issues and provide a basic level of service to every single citizen, regardless of their income, regardless of whether they have money in their pocket or not. They deserve access to a basic dental service. Gara maith agat.